Welcome. In this video, we'll explore a complex and increasingly recognized health challenge, cardiovascular-Kidney-Metabolic, or CKM, syndrome. This isn't just about having heart, kidney, or metabolic problems individually. It's about how these conditions are interconnected and worsen each other, creating a vicious cycle affecting millions worldwide. Understanding CKM syndrome is crucial for effective prevention, diagnosis, and management, ultimately improving patient outcomes. So, what causes this intricate interplay of cardiovascular, kidney, and metabolic issues? The etiology of CKM syndrome is multifactorial, meaning it arises from a combination of genetic predispositions and environmental factors. Key contributors include obesity, particularly abdominal obesity, insulin resistance, and high blood pressure. Genetic factors play a role in determining an individual's susceptibility to these conditions. Lifestyle choices like a diet high in processed foods, sedentary behavior, and smoking significantly increase the risk. Exposure to environmental toxins can also contribute. Often these factors interact, accelerating the development of CKM syndrome. To understand CKM syndrome, we must delve into its pathophysiology. Imagine a domino effect. Insulin resistance, often triggered by obesity, leads to elevated blood sugar and increased insulin production. This in turn contributes to inflammation, oxidative stress, and endothelial dysfunction, damage to the inner lining of blood vessels. High blood pressure develops as the body attempts to compensate. The kidneys, overworked to filter the excess glucose and manage fluid balance, begin to suffer. This leads to chronic kidney disease, which then further exacerbates hypertension and metabolic dysfunction. The heart, stressed by high blood pressure, inflammation, and impaired kidney function, experiences hypertrophy and enlargement of the heart muscle, and eventually heart failure. It's a complex web where each organ system negatively impacts the others, creating a self-perpetuating cycle of disease. CKM syndrome is a significant public health concern. Epidemiological studies reveal its increasing prevalence, particularly in aging populations and those with pre-existing conditions like obesity and diabetes. It is estimated that a substantial proportion of individuals with chronic kidney disease also have cardiovascular disease and metabolic abnormalities. Certain ethnic and racial groups are disproportionately affected, highlighting the role of social determinants of health and access to care. The rising rates of obesity and diabetes worldwide are driving the increasing prevalence of CKM syndrome, making it a global health challenge. Recognizing CKM syndrome early is vital. Symptoms can be subtle and often overlap with those of individual cardiovascular, kidney, and metabolic diseases. Common signs and symptoms include fatigue, shortness of breath, swelling in the ankles and feet, edema, high blood pressure, elevated blood sugar, abnormal cholesterol levels, and protein in the urine. Individuals may also experience chest pain, irregular heartbeat, and decreased urine output. However, in the early stages, many individuals may be asymptomatic, emphasizing the importance of regular screening, especially for those with risk factors. Diagnosing CKM syndrome involves a comprehensive assessment. This includes a thorough medical history, physical examination, and laboratory tests. Blood tests will assess glucose levels, kidney function, glomerular filtration rate and creatinine, cholesterol levels, and markers of inflammation. Urine tests can detect proteinuria, an indicator of kidney damage. An electrocardiogram (ECG) can assess heart rhythm and electrical activity. Echocardiography can evaluate heart structure and function. Imaging studies, such as kidney ultrasound, may be performed to assess kidney size and structure. The diagnostic process aims to identify the interconnectedness of cardiovascular, kidney, and metabolic abnormalities. While CKM syndrome isn't formally classified into distinct types, in the same way that some diseases are, it can be characterized based on the predominant features or the stage of progression. For example, some individuals may present primarily with metabolic dysfunction leading to later cardiovascular and kidney involvement. Others may initially exhibit kidney disease which then triggers cardiovascular complications. Understanding which aspects are most prominent helps tailor treatment. Furthermore, staging systems for chronic kidney disease and heart failure can be used to assess the severity of the syndrome. Defining the primary drivers of the syndrome in each patient helps in creating targeted therapy. Managing CKM syndrome requires a multidisciplinary approach. The cornerstone of treatment is lifestyle modification, including a heart-healthy diet, regular exercise, weight management, and smoking cessation. Medications play a crucial role in controlling blood pressure, blood sugar, and cholesterol levels. Angiotensin-converting enzyme ACE inhibitors or angiotensin receptor blockers and ARBs are often used to protect both the heart and kidneys. SGLT2 inhibitors, originally developed for diabetes, have shown significant benefits in improving cardiovascular and kidney outcomes. Diuretics can help manage fluid overload. In advanced cases, dialysis or kidney transplantation may be necessary. Managing CKM syndrome is a long-term commitment, requiring close collaboration between patients and healthcare providers. Preventing CKM syndrome is paramount. Adopting a healthy lifestyle early in life is the most effective strategy. This includes maintaining a healthy weight, eating a balanced diet rich in fruits, vegetables, and whole grains, engaging in regular physical activity, and avoiding smoking. Regular screening for risk factors, such as high blood pressure, high cholesterol, and diabetes, is crucial, especially for those with a family history of these conditions. Early detection and intervention can slow the progression of CKM syndrome and prevent serious complications. Public health initiatives aimed at promoting healthy lifestyles and preventing obesity are also essential. The prognosis for individuals with CKM syndrome varies depending on the severity of the underlying conditions and the effectiveness of treatment. Early diagnosis and aggressive management can significantly improve outcomes. However, CKM syndrome can lead to serious complications, including heart failure, stroke, kidney failure, and premature death. Recent research focuses on developing novel therapies that target the interconnected pathways involved in CKM syndrome. New drug classes like mineralocorticoid receptor antagonists, MNRAs, are being investigated for their potential to improve cardiovascular and kidney outcomes. Research also explores the role of biomarkers in predicting disease progression and tailoring treatment strategies. The future holds promise for more effective treatments and improved outcomes for individuals living with CKM syndrome.